Hello guys, this is Dr. Palaniappan Manickam. In this video, we're going to talk about hair loss and how it is related to intermittent fasting and time-restricted feeding that I've been promoting. As you can see, both of the topics are very close and personal to me. Let's dive deep into it. If you think you got anything out of this video, please do not subscribe. Please consider donating to our non-profit organization called Aishwaryam Trust in Madurai. We take care of hospice patients who cannot walk, talk or move and who require 24/7 nursing assistance. We provide food, shelter and medical care completely free of cost. Please check the link in the description. If you are living in US, you could consider donation to Vannamalagal Foundation so that your donation can be tax deductible. The website for Vannamalagal Foundation is in the description as well. So the most common complaint I get when people try intermittent fasting is that they are losing their hair. Not because they are trying to follow this intermittent fasting and losing their hair. It is because they are losing the micronutrients in their daily diet because their calorie intake is reduced, and this is what happened to me as well. You must have heard many people saying that intermittent fasting actually can cause hair loss, and multiple people have experienced hair fall during intermittent fasting. This is mainly because they have not adopted the right technique. In intermittent fasting, usually you restrict the amount of calories because your number of meals goes down. When you restrict your calories, it is absolutely important that you have to have a balanced diet of micronutrients, which is absolutely critical in promoting the hair growth. So before jumping into what can be done, let's focus on the normal pathophysiology of how a hair is grown and how the hair is being fallen off and what can be done to get the hair back into the growth cycle. So the hair that we see on the top of the scalp and other parts of the body is just 50% of the entire length of the hair. The remaining portion is actually deep inside the skin, and the bottom of the hair is called hair bulb, where there are these stem cells deep within this root. The stem cells make thick protein called keratin, and these keratin makes the hair grow thicker and it starts growing slowly. After a usual span of like 5 to 6 months, the growth stops and starts falling off again. This is the normal hair cycle, and the duration differs based on the location of the body. So for scalp, it is around 5 to 6 months. For eyebrows, it could be longer. So it is dependent on the location of the body hair. So the key thing that you should remember is if we can preserve the hair bulb where there are stem cells, we can make sure that the dying hair can actually enter back into the hair bulb and stem cells can actually make it grow again. This is the critical factor I need you to understand. For the stem cells to be active and for the hair to enter the growth phase again, it is absolutely critical to make sure that the blood supply to this root or the hair bulb at the base of the hair shaft is absolutely important. As long as the blood supply is there, there is more oxygen, more nutrients, the dying hair actually gets back into the growth phase, and this vicious cycle continues so that you will not have any hair loss at all. So this is the bottom line, and I'm going to tell you my personal experience in terms of intermittent fasting regarding what happened. The leaves fall during the fall season, but my hair fall happens in all seasons. My mom was very proud of me, thinking that I'm cleaning the room. I used to check how much amount of hair I was losing. So usually in intermittent fasting, as we mentioned before, because the calorie intake is reduced, if there is no balanced diet, the micronutrients necessary for the blood supply to this hair bulb can go down, and that is why people actually experience some kind of hair fall in the first 6 weeks until your body gets adapted to this new style. But the concept that I am promoting, which is time restricted feeding from sunrise to sunset, which is a subset of intermittent fasting method where you cannot choose your timing late at night, it's going to be early dinner, maintaining that same eating window. So when you do that, you're just following the body's natural cycle of shutting down the insulin at sunset. Once the insulin goes down, melatonin kicks in. When melatonin kicks in, this is the sleep hormone, which means this is making your body to start sleeping or shutting down slowly. It creates all the environment that the body needs to sleep. So when the environment is reached, then the growth hormone, which is absolutely necessary for the blood supply to your hair bulb, gets secreted maybe around like 9 or 10 p.m. and then starts reaching the peak at at 2 a.m. and it slowly subsides back again at 6 a.m. and 7 a.m. when the sun rises, and you can start eating, your insulin rises again, and the vicious cycle keeps continuing. If we can follow this natural rhythm of eating at sunrise, stop eating at sunset, we can preserve this melatonin production, growth hormone production, make sure that the blood supply to your hair fall is preserved. Unfortunately, due to work-related pressure, in younger days, we don't sleep properly. The whole cycle is messed up and we start losing our hairline. And even more unfortunate is that this phase coincides with your marriage alliance phase. Some alliances are rejected just seeing their head. Their headline becomes the headline of discussion. So remember, your hair bulb is very important. Your growth hormone is the fuse plug of your hair bulb. So I am a living example that this method works. When I used to do intermittent fasting from 2 p.m. to 10 p.m., I started noticing a lot of hair loss because my diet was not that balanced as well. In addition to that, my sleep pattern was not good either. When I shifted my dinner time earlier around like 7 p.m. and continued the same 8-hour eating window, I started to notice to preserve whatever amount of hair that I have. So the most important point people usually miss is sleep is the main reason for preserving your hair. Again, following the natural hormonal cycle of eating at sunset, melatonin increases, growth hormone is secreted only during sleep. If you don't have good quality 7 hours of sleep, there is no way that you're going to preserve your hair. So the one technique that actually helped me to get good amount of sleep is to include foods rich in tryptophan like milk, almonds, pistachios. I used to eat this at the dinner time around 7 p.m. and go to bed at 10 p.m. Tryptophan helps you to sleep better, helps you to secrete more growth hormone, which helps you to preserve the hair that you have. My friend Sarana Kumar keeps increasing the speed of his fan. He doesn't believe in tryptophan, he believes in kaitan fan. Similar to growth hormone, there is a hormone called IGF. This is secreted during the first hour of sleep, and this also promotes blood supply to the base of the hair like root bulb and make sure that the stem cells are growing. The key factor to remember is this is secreted only during the first hour of sleep to its maximum quality. For example, if your body is tuned to be slept around like 10 p.m. is your bedtime, it is being secreted between 10 to 11 p.m. Let's say for some reason you keep sleeping at a variable time, your body will get confused when to secrete this IGF and will stop secreting it. I strongly think that IGF should be very strong for our KGF movie hero Rocky Boy. Look at his long hair. His mother might have been so strict on his bedtime. The one thing the IGF doesn't like is alcohol. Alcohol absolutely disturbs the sleep pattern, so the sleep cycle is not initiated. You lose the first golden hour, which means the IGF is not secreted. So when you drink alcohol at night, you more likely tend to lose hair more. You could do this test in your friend circle. If you closely analyze, people who drink alcohol are more likely not to have any hair compared to people who don't drink alcohol. My friend Sarana Kumar is saying, that's okay da, I'm going to drink alcohol in the morning from now. He loses hair whenever the Chennai Super Kings play. When CSK lose, he drinks alcohol due to sadness, and when CSK wins, he drinks alcohol due to happiness. So which brings us to the next point, that how to increase this quality of insulin-like growth factor. The name itself contains insulin-like, which means that if we preserve the quality of our insulin, this insulin-like growth factor will also work very well. As you all know, if you follow my channel, if our waist circumference is more than 80 centimeters in women and more than 90 centimeters in men, you have some kind of insulin resistance. Your insulin is not working that much. If your regular insulin is not working that much, your IGF will also not work, so the hairline can start receding. If you closely look, if people are having a big belly, they are likely to have a receding hairline. If you are coming forward in your life, your hairline tends to go backward. We have talked on this channel that time restricted feeding improves insulin resistance. In addition to that, 150 minutes of exercise per week is shown to improve insulin resistance. This 150 minutes doesn't have to be at the same time. You could do like 30 minutes a day for 5 days. But the key thing is you need to exert yourself to increase your heart rate. My patient Arokya Sami, instead of doing physical activity, he plucks an eyebrow hair, closes his eyes and makes a wish that his hair fall should stop and blows it. When he opens opens the eye, even that hair is gone. And when people starts walking as an exercise, I don't see them exerting at all. My friend Saranakumar's wife, Tirupura Sundari, who is my friend as well, as soon as she steps out for walking, she calls her mom over the phone and then say, Amma, எப்படி இருக்க? அப்புறம் அந்த உளுந்து வடைக்கு எவ்வளவு உளுந்து போடணும்? And during the walk, she sits down for 10 minutes to write down the recipe from her mom, and she comes back home and makes the same medu vada. So far we have talked about the natural resources of preserving hair loss, right? So if you follow number 1, time restricted feeding, number 2, sleep quality of 7 hours, number 3, making sure that you go to sleep at the same time so that you can preserve your IGF, and number 4, if you do physical activity of 150 minutes a week, you can definitely preserve your hair, maybe even promote mild hair growth as well. So the next point is, what can you include in your diet to promote hair growth? We talked about tryptophan rich foods like pistachios, almonds and milk, so that will help you promote sleep, that will promote growth hormone, that will promote hair growth. In addition to that, if you can include iron rich foods, that will also help you prevent hair loss. Iron is absolutely important for the stem cells to produce thick protein like keratin to build hair. So plant sources of iron rich foods include beans, legumes, lentils, broccoli and spinach. The cartoon character Popeye eats spinach and becomes strong, but our cartoon character Chota Bheem eats laddu and becomes strong. Non-vegetarian options include eggs, chicken, turkey, seafood like mussels, oysters or so much rich in iron. My patient Arogyasamy breaks the egg, pours the yolk into the whiskey, thinks that yolk will give him iron and absorb all the toxins in the whiskey bottle. He's the number 1 Ayokian. One small tip in taking iron is you can take the iron rich foods along with vitamin C like an orange, which helps the iron absorption better. On the same note, if you can avoid taking calcium rich foods at the same time, it will be better for iron absorption, because calcium rich foods like milk can interfere with iron absorption when you are taking it. So you can take the milk a couple of hours after when you are eating spinach, beans or any iron rich food. So now let's focus on medications which can prevent your hair loss. In this category, the number 1 medication is called minoxidil. It is available over the counter here in US and it is available in all pharmacies in India. It comes in 2 doses, 2% and 5%. The mechanism of action is minoxidil actually dilates the blood vessels supplying the root of the hair, which is called the hair bulb. That's where the stem cells are. You apply it locally. It comes in foam or in solution. In foam form, you just spray it. In solution form, you just apply as a drops. Even though the side effects are very, very minimal because it is not absorbed in the body 100%, 1 to 2% of this ingredient gets absorbed in the body regardless. Some patients might develop headache or some palpitation, so you should start very slowly. If I were you, I will start with 5% once a day and then see how you respond. Because this minoxidil dilates the blood vessel, more oxygen, more nutrients goes into the root hair bulb so that the hair grows. I think minoxidil should be sprayed at the entrance of Saravana stores during festive season. It will dilate the entrance passage, allowing more oxygen so that people can actually breathe. Remember, minoxidil will help you only preserve hair, will not promote hair growth. Once you see positive results with minoxidil, it is likely that you might have to apply this on a daily basis to sustain the results. I once gave a missed call to 4050 and they told me to use a hair oil made of herbs from Amazon forest. After using it, my head underwent deforestation and turned out into a Sahara desert. The other possible medication that can be applied locally is caffeine ointments. Multiple research studies are showing that caffeine ointments can actually prevent hair loss. The efficacy is almost similar to minoxidil, but the side effects are almost zero. These caffeine ointments are available over the counter, available in Amazon. You can try it out with a small dose of 2 mg per ml. Usually it is applied 3 times a week. There is no significant research on this field, but because it doesn't have any side effects and because of possible promising results, it might not be a bad idea to try this out and then see whether this will work out for you, because it is shown to prevent hair loss. When you find someone with more hair than before, you could actually say, something is brewing. My friend Saranakumar says, I want shiny, silky and black hair. What coffee should I drink? Espresso, Americano or cappuccino? I said, to preserve that one hair strand on your head, you could better use tea. Nowadays, you might see an ad for a coffee powder. It might be actually a hair oil ad. So I want to emphasize that all these tips and tricks that I'm telling you is helpful only to preserve the hair. Most of this will not promote hair growth. There is a medication called finasteride which has been shown to promote hair growth in certain population. For that, I would recommend you to talk to your doctor to see whether you might be a candidate for that medication because it does have some side effects. So let me summarize this for you. During intermittent fasting, it is common to have hair loss during the first 6 weeks until you get used to it, until you form a balanced diet during those restricted eating window. To counteract that, you could change your eating window earlier. Sunrise to sunset method will make you sleep better, promote more growth hormone secretion, help you preserve the hair what you have. Remember, sleep is very important. At the same time, going to bed at the same time every day to preserve the insulin-like growth factor which is secreted in the first hour of sleep is absolutely critical. No alcohol anytime, especially at night, because this disturbs the insulin-like growth factor and also the sleep pattern which completely messes up your circadian rhythm. Eating tryptophan-rich foods like almonds, pistachios, milk, and eating iron-rich foods like spinach, broccoli, beans, legumes, lentils. Non-veg options include eggs, chicken, turkey, seafoods like mussels, oysters, all rich in iron can actually promote stem cell proliferation which will prevent hair loss. When it comes to medications, you can start with topical minoxidil and topical caffeine ointments and then see how you respond to that. Bottom line is you could do all this to prevent hair loss and discuss with your doctor regarding finasteride to promote hair growth. So remember, there is no one size fits all. Everybody is different. If you can follow these simple natural steps following our circadian rhythm, most likely the hair loss will be prevented, and minoxidil and caffeine ointments can actually add on to the existing mechanism so that the effect lasts longer. I'm taking time to explain all this because hair loss and fear of hair loss has been a major problem in my patients in adopting intermittent fasting. I'm going to tell you that please use these techniques to prevent that from happening, and I can guarantee you that within 6 weeks your body will get adapted and you might not experience that much amount of hair loss. And make sure that your diet is completely balanced with all the micronutrients including fiber to make sure that there is no hair loss. Remember, one belly at a time. It is absolutely important. I will see you in the next video. Bye bye.